talk a lot on this channel about ancestral consistency, how I believe that it's extremely important for us to be careful with certain interventions, basically introducing multiple different interventions, especially technological interventions into our lives, but also dietary interventions is what I mainly focus on my channel and also in my book, Contraindicated. And precisely because evolutionary indication is based upon what our genes have been evolved withstanding and encountering throughout the majority of its existence, or throughout a sufficient amount of time, or a significant amount of time, sufficient enough to have caused full genotypic adaptations to those stimuli. And that, sure, is very relevant to our dietary changes. However, there is something that I very rarely talk about on this channel, which is actually structural health, connective tissue disorders, etc., etc. You may know me as someone that has and suffers from a connective tissue disorder, hypermobile EDS, which is reversible, as much as many people would say that it's not, but it is reversible with certain interventions. And those interventions are holistic in terms of the ones that I actually support and the ones that seem to be the most effective and the least invasive. And so I wanted to take time today and discuss this with a doctor that has actually treated me in Florida multiple times, Dr. Brian Hutcheson, a chiropractor that specializes in the treatment of connective tissue disorders in one specific way. It is not a full fix per se. I use it in tandem with PRP and prolotherapy. Anyone that's curious to understand what that is, you can once again buy my book, Contraindicated. I talk about this in the epilogue, but also I've done many interviews. I've been interviewed by multiple people, one of which Dr. Sarah Zaldivar is one of the first people that comes to mind that has interviewed me about this topic, where I extensively elucidate such processes, I expound upon them, and such treatments. And they're very effective, they're very regenerative and holistic in terms of their approach. It utilizes the body's own intrinsic healing properties to basically recover from chronic illnesses that may have nothing to do with diet, actually, and may actually have to do with connective tissue disorders that are caused by different things. And Brian and I actually talk about this in the interview. I just got done interviewing him, and I think it is of critical importance that people understand that this may very well be the reason why you are only 80% there in your journey to reclaim your health, or maybe 70%. It may have nothing to do with diet, your brain fog, your chronic fatigue. It may have nothing to do with any of this stuff. It may be a blood flow problem, maybe an actual structural issue, which is an issue precisely for the same reasons why our current dietary supply is causing us such issues, metabolically speaking. It is because of ancestral inconsistency. It is because of computers and phones and postural issues. And I think that all of us, even people that don't have connective tissue disorders, deal with this to some degree. It has become an epidemic. This metabolic disorder epidemic was an epidemic for decades before we actually identified it and recognized it as an epidemic. This, I think, is fitting the exact same pattern, where for decades we haven't even realized that this is an epidemic. It is a hidden epidemic, and I'm hoping to make it even less hidden, okay, much more exposed. Brian is a genius, frankly, even in the regenerative health space, in the structural health space, the regenerative structural health space together, actually. He is an absolute genius. Just by looking at you, he can tell you exactly where your structural issues are, where he can identify them immediately, and frankly, it's miraculous how he does this, and I'm not just saying that to blow smoke, frankly. I know this from experience, that he is a genius. So he was the best, most appropriate choice for talking about this on the channel, and so I look forward to your comments about this. I look forward to hearing your perspectives in the comment section below after the interview, but let's waste no further time. I know I say that after talking for a few minutes, but I think it's incredibly important to really hype up, first of all, the importance of this concept, this epidemic, but also Brian as a doctor, okay, because he is to be trusted. He is very humble, he is very analytical, he's very erudite when it comes to this. So without further ado, let's get into this interview, and I once again look forward to hearing your thoughts in the comment section below. So let's get into it. All right, Dr. Brian Hutcheson, I am extremely excited to talk to you. I've been wanting to have you on the channel for quite some time. You bring an entirely different and quite frankly genius perspective to health, particularly not sort of a mainstream image or approach to health, which I think, in my opinion, is exactly what we need, is not that. We need a more holistic approach, and I think you have a far different perspective. I talk a lot on this channel about diet. You have a much different perspective. Not that diet is unimportant in your vision, but that it's only one piece of the puzzle. And so I'd really like to talk to you about what that piece of the puzzle is, why you think it's so important. And I think the best way of getting into that is having you talk about what you do and what did you do before that? What led you to what you do now? And what do you specialize in?
Eddie, thank you for the introduction. And, we've known each other for about 3 years, right? Maybe 2 or 3
Mhm.
years. And I know that you've been on a lifelong journey to battle with some of the connective tissue challenges of hypermobility and Ehlers-Danlos syndrome. Is it correct?
Yep.
And so, you've really modified your diet. You're primarily or exclusively carnivore. Is that correct?
Yep.
And
I've been that
that's
way for a few years now. Yeah.
years, and it's helped you in tremendous ways. I see that you talk about that a lot on your channel, and I think that the reason that you've wanted to bring me on board today as somebody to speak is because of the unique approach that I have to helping connective tissue heal. And so I got into this area because my brother had debilitating scoliosis growing up, and he ended up getting the Harrington rod surgery, where you get metal put from your upper thoracic spine down to his lower lumbar spine to fuse his spine so that it wouldn't progressively worsen and compress his organs and lead to, essentially a life-threatening event. And during the course of time that, I went and became a chiropractor and tried to figure out why would 10% of my patients not get better. I was doing the right adjustments, the right rehab. I was performing acupuncture at that time, referring to neurologists or other specialists. And there was still I would say on average, about 10% of people that walked in the door that either weren't getting better or would leave the office feeling incredible, only for 1 or 2 days to pass and their symptoms to return. So I got led down this cascade of, what's the missing link when it comes to structural health? The people were seeing integrative doctors, holistic doctors, nutritionists, naturopaths, optimizing their whole day-to-day routine with what they put in their body, chemicals around them. But there was 10% of people that were still sick. So I ended up performing or purchasing a digital motion X-ray after months and months and months of consulting everybody that had one and talking to my professor from National University of Health Sciences and Radiology. And he tried to actually persuade me against getting a digital motion X-ray. He said the marginal utility is so small of what you're going to be able to see and obtain that you really shouldn't even get it. And so I had to go against conventional wisdom to start to look into one of the missing causes of chronic pain, of all sorts of dysautonomic symptoms to perpetual problems in the absence of findings on conventional imaging. And then now it's been actually 10 years in 2025 since I've had a digital motion X-ray that I've been trying to explore one of the missing causes of structural problems, which is some form of instability. And I know that you've talked about it before on your channel about prolotherapy. You've had talks with other, leaders and influencers in this field and explaining your experience with prolotherapy. I ended up going to these seminars where people would talk about instability and digital motion X-ray and some, cutting edge technology in order to help people that have instability. I worked with a regenerative medicine doctor that Dr. Hauser for a few years.
Hmm.
And through that, it was incredible because I saw people getting better from conditions that I knew they had, such as, upper cervical instability, excessive movement between vertebrae due to ligament laxity, which doesn't always show up, Eddie, as full thickness tears on MRI, but it can be these very subtle changes on a microscopic level that are really even sometimes hard to see on really high resolution diagnostic ultrasound. It's interesting because there's so many doctors nowadays that are very guided based on what the imaging shows or what the lab tests reveal. And I think that the missing link is the human component of taking all of the diagnostics, taking the blood work, the lab values, the radiology reports, the images, and then combining that in real time with how your client or patient function. So one of the things that I discovered over the last 3 years, which I wasn't actually aware when I guess discovered it, that no one else was really doing it like this, but was just how important that the health of our tendons are for our connective tissue and overall physical structure. So, Eddie, I just went on probably like a 3 minute you know, solo talk. So interrupt me and tell me how you want me to guide the remainder of the conversation.
No, yeah, there's just a few little sort of subsidiary notes that I have. You talked about a DMX. So you talk about how a lot of things like the conventional sort of scans, like for example, a regular X-ray has a sort of, minimal amount of information comparatively to what a DMX can show. Um, can you tell the audience specifically for the audience what the difference between a regular X-ray is versus a digital motion X-ray and what the things are that you can find in a digital motion X-ray as compared to a regular one? What things are usually missing in a normal conventional X-ray imagery?
So the first X-ray that was ever created back in the very end of the 19th century was video X-ray, or essentially rebranded as digital motion X-ray. So video fluoroscopy has been around since the beginning, but most of the time for diagnosis, doctors use static imaging, which means they just take one picture of you in one moment of time. In digital motion X-ray, the value is that now with advanced kind of ways of reducing excessive radiation, we're able to get a picture of a person in motion. So we can watch you while you do normal motions, lateral bending, forward jutting, rotation, and look to see how is the integrity of the movement between individual vertebra and then also more globally between the entire neck or between most of the thoracic spine or the shoulder. And there's so much that can be uncovered when we watch people during movement that we cannot gain information on when they're just sitting still or laying down.
Right. Yeah, and I actually know this from personal experience because I've gotten X-rays done before, and for people that are unaware, if people are I've stuck around for quite a while and been watching my channel for a while. You already know that I have hypermobile EDS. Effectively, there's a technicality that maybe says that I don't, but effectively, I really do. Symptomatically, they all match, all the symptoms match and everything. But therefore, I've had regular static X-ray imaging done that shows effectively nothing is wrong with me. And that's why I'm really glad that you just mentioned something that I talk about on my channel all the time. Um, just having the appearance on imagery or a test or something like that that's within normative ranges, for example, or within, what's considered normal, what it's normally encountered, does not necessarily mean the person is healthy, and also vice versa. If you're out of range or something like that, it doesn't necessarily mean you're unhealthy. It's all about
Correct.
presentation. It's all about the
Yes.
presentation of the patient. And
Th-
so I'm it's very important to be able to also understand that since there's limitations with those, static imaging and all that other stuff, that there may very well, if your patients are still exhibiting symptoms despite the fact that everything is coming back normal, there may very well be something that is missing that can be found with an alternative, unconventional approach. So I'm glad that we actually got into the whole DMX thing. I didn't even know that the first X-ray image was actually taken with DMX. I didn't even know that. I thought that was advanced technology, but that's interesting. I do want
And
to touch on,
real
yeah,
quick,
no, you're good.
that's
Yeah.
that's probably the most important thing that we're going to cover today is what you just mentioned, which is people can be within normal ranges on imaging or labs and still have a problem. And then the other side of that equation is that people can be abnormal, such as you can have instability or you can have a low value in one area of your lab results, and you can be still expressing health on a very high level. And it's more that we need to take in the entire equation, which is how is the person functioning? What's the state of their entire being? So, are they waking up healthy? Are they grateful? Are they eating well? Do they have good people around them? Is their environment safe and clean? And are they getting fresh air and, grounded and, exercising and, you know, are they aware of their posture and having habits that are supportive for health? And if they're doing all of these things, but you still have one measurement that says, oh my goodness, there's 4 millimeters of overhang at this one bone, or wow, your one lab value is just barely outside of the normal range, or your cholesterol is just a little bit high, then you really don't need to take action very often on those. They're more to be aware of maybe your vulnerability and
Right.
potentially plan over
Yeah.
time.
Yeah.
So,
No, I completely agree with that. Let's start focusing specifically for people that are unaware, because once again, on my channel, I mainly emphasize, like the chemistry of the body with respect to dietary implications, if that makes sense. Um, Not very often do I spend time talking about structural health on this channel, which is why I was excited to do this, because I believe that, like I said in the beginning, what you believe is what I believe, which is basically that diet is a big factor. It may even be the most salient factor, depending on who you are. But it is still one piece, one part of the puzzle, one piece of the puzzle. And so you mentioned instability, which is really, it starts getting into structural health. Can you explain, just sort of give a slight rundown, a quick rundown as to what instability is and what the primary causes that you've seen at least are of this condition?
So first, I'll give people a reference of think about like a bag of bones. You know, around Halloween time, we've all seen a skeleton that kind of like decomposes and falls on the floor and then regains its form. And so the things that keep together our skeletal form for our ability to move and express life as a human being is our connective tissue. And that consists primarily when it comes to load bearing and force distribution to the tendons and the ligaments. And the fascia plays a little bit of a role in kind of distribution of force, but not really activation. When a muscle fires, that's kind of like the engine that moves your body. And then the tendons have to actually be the part that acts on the bone to move it through space.
Mhm.
So
Yep.
when we talk about instability, we're talking about does your body have an inherent constitution that allows it to keep form at ease? Or does it actually break down very easy? Or is it vulnerable to being in a position for a couple seconds or a few minutes or a few hours and then feeling like it can't keep its form together anymore?
Right. Okay. Yeah. Yeah. That's a sufficient brief explanation there. Once again, what are the primary causes that you've seen for this condition? Do you think it's just poor posture, maybe injuries or something like that?
I think that the people that suffer the most, they have some kind of a congenital or acquired connective tissue system-wide disorder where, Eddie, am I free to talk a little bit about you? Because, you know,
Yeah.
are you,
No, definitely.
okay.
Definitely. Yes.
Okay. So you know how like when you stand that your arches collapse and you know
Yep.
it's like a system-wide thing. So you stand, your
Yes.
arches collapse, your ankles can't hold themselves upright. You know, you have all these areas that just give out and you're like, why are you doing this? You know, I'm young,
Yeah.
I'm healthy, I'm doing everything right. I'm working as hard as I can. But you know, the connective tissue can be inherently vulnerable as, you know,
Right.
an individual constitution. And then in other people that don't have that constitutional crisis of connective tissue, it can be acquired through trauma, through poor posture, through excessive, you know, manipulation. If every single time, every day, you're constantly like really adjusting yourself super hard, always clicking and popping things, that can over time lead to it getting progressively lax because you're not addressing the root of the problem, which is that the tendons and our ligaments need to be addressed. And I don't want to go off onto too far of a tangent with this, but did I answer that one okay?
Yeah, no, no, you're good. I mean, look, this is your time to shine here. You can say whatever you'd like to say on here. I'm not on a strict time limit. Maybe you are, but I do want to. Yeah, so I want to elaborate on this because there's a reason that I asked you about the what you think the causes are. I talk a lot about sort of ancestral or evolutionary consistency on the channel, as well as in my book, particularly in my book, but especially on my channel, and how many things we can sufficiently sort of adapt to, such as small interventions, which come with, small amounts of associated cons and pros, and small degrees of extremes with respect to the side effects of those cons and pros, things like climate controlled environments, something that we never really adapted to, or we adapted, we never experienced it before. And then we sort of started adding interventions in like climate controlled environments and all this other stuff that we have today. But there are other interventions that are very starkly different from our previous behaviors, such as rapid dietary changes, or in this case, postural changes due to technological interventions that our bodies seem to not have been able to sufficiently adapt to as of yet. It was like too quick of an intervention. Do you think that these side effects, however, have reached a degree of being able to be characterized or classified as a hidden epidemic? I'm curious to know, because if so, why would you say so?
Well, that's the reason that I'm in San Francisco right now. So I'm designing a software called Posture Vision, and we're essentially going to allow people to maintain structural health while using technology. Because
Right.
yes, I agree 100% that it's an epidemic or, you know, it's something that's hitting widespread across the advanced, you know, tech-fueled world of multiple billion people that are on devices all day long, phones, computers, television, still just constantly bombarded with content. And, all of that is overwhelming. There's only so many decisions that we can make in a day without kind of like a decision fatigue. And so we're constantly bombarded with information. We're prone to falling into a posture that's less than ideal for us. And this is why it's so important. A lot of people you hear talk about like brain retraining or nervous system regulation and combining that with a really healthy diet. For many people that need a lot better collagen, a healthy quality animal-based diet can be really one of the best things for them. Um, and I think that it is an epidemic. I mean, that's why I'm spending literally almost every waking moment to design a solution for the world. And the it's interesting because you may see, well, there's this little old lady that's 80 years old in my hometown, and she has terrible posture, but she's bright as a tack, and she walks around fine, and she has no problems. And yeah, well, my grandfather smoked 2 packs of cigarettes a day for 20 years, and then 5 cigars a day for 20 years, and he's 97 and he's still alive. Do you want to be the exception, or do you want to follow the area that you're most likely going to have success? So this goes back to just finding a problem doesn't mean it needs to be treated. And the absence of a problem on conventional imaging or diagnostics doesn't mean somebody doesn't need to be treated. So I see too often nowadays, Eddie, that doctors, really smart ones, practitioners, that any profession, but the area that I'm in is structural health. So I see some structural health doctors that will literally determine the entire course of care of somebody based on what an image result says. And I think that this is absolutely crazy because these people are extremely bright and they're almost sometimes too bright for their own good because they'll look and be like, wow, there's a 5 degree angulation of this bone on another one. So that's the only problem. Or they'll be like, this bone slides over 3.3 millimeters. So you absolutely have this deep ligament problem and you need to get this treatment done. And I'm like, right now, for people that are knowledgeable on structural health and instability, I have what would be considered to be moderate to severe C1, C2 instability, or the first bone in my neck and the second bone, but I have zero symptoms neurologically. I mean, I've literally been working every day, flying airplanes, traveling, being in less than ideal positions, not my normal routine with food or exercise, and I'm still feeling extremely well. So, I think that we have to find out how do we collectively and also as practitioners bring in that human component to a much higher level. And that's something that I'm trying to do with creation of my software Posture Vision.
Yeah, I'm glad that you mentioned that. I actually completely forgot to even inquire about that because I was so focused on trying to ask you all these other questions. But yeah, no, I'm looking forward to that technology because I'd like to see how it can help people. Because I think that's the best thing to do. Is if you're going to have an intervention that's sort of administered or introduced into a population that is technologically based, that's something that we haven't really adapted to or ever encountered before. So now we're having to adapt to this. Like you said, some of the adaptations are great. Some of the benefits, the pros are great. For example, with technology, with like computers and stuff like that, it's efficiency of communication. It makes work more efficient and all this other stuff. But there's always unintended consequences. Well, one of the great things about the human ability to adapt and the human ability to reason is that you can actually use technology against itself by helping yourself with the problems that develop from technological use, like poor posture causing connective tissue problems, to fix your connective tissue problems. So I think it's like it's a paradoxical sort of solution. So I think that that's really good. But then again, I keep emphasizing this. This is why I had you on the channel because as much as it is true that you know again, and this may not be your philosophy, but again, this is what I say on my channel. This is my philosophy on the channel. I think that evolutionary inconsistency, rapid development of certain things and rapid introductions of things that we have not had sufficient time to fully adapt to minimize the associated cons of those introductions is the major sort of cause and underpinning etiology, so to speak, of a lot of these modern day problems. And so it doesn't just really, that's why it was one of the things I focus on, main thing I focus on is diet. But there's another reason, that's the main reason I'm having you on here is because it's not just diet. There are other things that we have introduced, interventions that we've introduced that have caused other epidemics, other hidden epidemics. Yes, we have a diabetes epidemic, we have a metabolic syndrome epidemic, but we also have a structural epidemic. And so that's another reason, that's the main reason I wanted you on this channel. So What are some of the things that these structural issues that we're talking about can cause that people may think are caused by completely different things that you've seen, or that they think aren't even symptoms to begin with, but are actual diseases in or but they think are actual diseases in and of themselves?
That's a great question, Eddie. And I'll lead that with saying that the number one book that shows how long that your tendons or connective tissue need a break after 8 hours of constant activity shows that you need approximately 24 hours of rest before engaging again in another 8 hours of a sustained position or movement. So let's say that I'm sitting at my desk for 8 hours, and maybe I had a really long day. I had to go back to the computer later for another 3 hours. So now I've done 11 hours in that day, and then I sleep 8 hours and I'm back up immediately in the same position again. So this is the pathology that you're referencing, which is so rapid of a new position that everybody's in. I mean, back maybe before computers, the amount of people that sat and just wrote all day or read all day or sewed or worked forward on a desk or were drawing, it wasn't as many people. And if I'm correct, I would imagine that there's a few layers of this. So one of them is that the depth that the eye gets to take in does something miraculous for the brain. So, when we were looking at things that were paper and pen, our eyes were able to focus on different depths. And that actually is very healthy for your brain. So that's one way also we could become more cognizant or more aware of subtle changes that were occurring. And I think that the screen time, the problem with it is that it actually decreases our cerebral metabolism. So there have been studies that show that people that are watching computers, that are watching televisions, that the actual fluid flow and the metabolic rate inside of their brain reduces. I don't know if it's 20 or 30%, but it's significant. So you have a significant slowing of the processing ability of your brain. And then not only does that happen, but then we kind of fall into a sedentary behavior where we're so engaged with the screen, which is consuming us, that we're less likely to consider the position that our posture is falling into. So now we've set ourselves up to ignore the subtle cues that our body was trying to give us of awareness of where we should be when we get the first sign of discomfort, repositioning, maybe, breaks from the position that we're in. And we just fall into this progressive, uh, you know, pathway that starts to create a lot of the connective tissue dysfunction. So let's say you're doing 8+ hours a day, same position. The slow breakdown, it's called creep, hysteresis, and set, where your connective tissue starts to stretch. And normally, if you gave it the 24 hours break, it would have barely tightened back up. And the stretches we're talking about are microscopic. You can't see these on imaging until it's too late. So really, this is why when we find a structural health issue, where we're pretty convinced that part of the problem is coming from something with the structure, whether it be the neck or the thoracic spine or the low back or another area. A very common spot that's actually underdiagnosed is in between the clavicle and the cervical spine. So it's a major highway of blood and nerves from your heart to your brain to your heart. And so I'm finding more and more often that almost none of these clinics are adequately addressing the space behind the clavicle where the carotid sheath is, the vagus nerve, the sympathetic chain, carotid artery, jugular vein, and branches from the aorta that leave the heart are. So we find a lot of problems in that area as well. Now, trying to wrap up the question, if you'll kind of guide me back home on this one, the really problems that are happening are from repetitive low grade injury, and they're often not diagnosable with conventional imaging. So people can get, brain fog, heart palpitations, tinnitus, digestive problems, tachycardia, anxiety, restlessness, difficulty falling asleep, facial twitching, um, any visual problems, head pressure, feeling like you can't hold your head up, feeling vulnerable, like just something's off, but you can't tell what it is. Fasciculations, twitching, muscle spasms, weakness, activity-induced injury. So if you try to get stronger, you actually feel worse. So
Hmm.
the list goes on. I mean, there's so many different things that can happen from this slow breakdown in alignment, curvature, and stability. And those are the three pillars in my mind of structural health.
Yep. And another reason why I'm having you on this channel is because this is also useful for people that may have had rigorous dietary changes that they've implemented, and yet some things they may have gotten 90% better, maybe only 80%, but the rest of the 10 to 20% may have nothing to do with metabolism and may actually have to do with structural issues. Because most people talk about, brain fog as a symptom of poor diet, which, yeah, sure, but it's not the only cause or the only potential cause. It could be something else. A lot of these structural problems, the symptoms that people have structurally, that are due to structural issues, can very well, or a lot of these problems that people can be having that they think are a result of diet, they mimic the results of structural issues and vice versa. There's a overlap, there's crossover. So I would assume that one of the things that this could be causing is, like people have knots in their back or something like that. This could be a tendon issue. If I'm understanding correctly, I
Yes,
believe.
100%. And Eddie, tell us a little bit. Are you willing to share a little bit about your experience with the tendon dry needling?
Yeah. So again, it doesn't naturally come up on the channel, so I haven't talked about it, but it's not like I have a problem talking about it. Um, People may already be aware that I've had PRP and prolotherapy administered to me before, and it was very helpful. In fact, it saved my life, and there's no doubt in my mind that that happened. And prolotherapy and PRP specifically target the ligaments to cause a regenerative sort of inflammatory response to regenerate the area instead of having to get fusions and stuff like that. Now, something that I didn't even know about it at the time, but Brian was working at the clinic um, that I was receiving treatment from or at, and he left the clinic to start up his own private practice, and he was doing something different. And because he was a chiropractor at the Cary Medical Clinic in Florida, and so he opened up a new chiropractic practice, and he was doing something differently, which is tendon dry needling. And some people have a different image in their head. Different images come to their mind when they think of dry needling. This isn't simply or merely acupunctural superficial level dry needling. Okay, a lot of people they receive acupuncture needles where they're right on the superficial levels of the skin or like right on the muscles, right on the top, but it doesn't actively target the tendons, which is what Brian specializes in, especially now. And what you do, this is a different dry needling method where you will actually take the acupuncture needles and you will manipulate them um, to target the tendon directly multiple times. I think it's called vertical pecking. Is that what you call it?
Yeah, repeated fenestration, vertical pecking, something like
Yes.
that. Yeah.
Yeah, and it is designed to basically do the exact same thing, at least sort of, approximates the same sort of stimulus that PRP will perform or stimulate to ligaments, but on the tendon. It's a regenerative treatment to tendons. But it's not something, it's similar to PRP in that you will have sort of immediate stability in the area, but it's it's far more immediate, I think, in my experience with dry needling, where as much as it does take a few days for the inflammation and the healing to fully set in and fully complete, you will see immediate effects after having received it. When you stand up, if you have poor posture for some reason, that's really difficult to sort of like get into a proper posture, recruiting your muscle tissue for you will naturally have it occur after you have the dry needling done. So I've had this done multiple times, and it is the most effective, the most immediately effective treatment that I've ever received as someone who's on the extreme end of structural and postural issues, connective tissue disorders. But this is not just for people with connective tissue disorders like a congenital issue. This is also for people that have classic, ubiquitous structural problems like you were just talking about that could just only pertain to the neck in some people, but could also be systemic, like an entire, torso area, your back, whether it be, your ribs. In my case, my ribs are a big one in that regard. But I've had extreme success with this type of treatment. And I actually just recently saw a video on Instagram of another chiropractor doing the exact same thing, which told me that it's actually getting more and more popular. It had like 1 million likes or something. And I'm like,
Wow.
yeah,
Eddie,
no,
you
no,
have to share
yeah.
that with me. I haven't seen anybody else doing it yet.
Oh yeah, well, I hope that I can find it again. It was a while back, so I don't know if I can find it. I can't remember the page. It was just in my Explore page or something, and I was like, "Wow!" I had to leave a comment though, because I was like, "I'm really glad that this is actually starting to become, more more recognized
Yes.
because this is very, very effective." And of course, you'll have the comments saying this is a bunch of pseudoscience, like, because
Yeah.
whatever. But they
No,
clearly haven't experienced it before, you know.
exactly. And Eddie, so
So
you mentioned that when you got the tendon dry needling, it was the most immediate positive response that you've had. from a physical intervention on your pathway towards reclaiming your health. And so
Yeah.
just tell us real quick before we move on from that, like what did you feel immediately and then what's been sustained just from us working together just a handful of times? I mean, we haven't even, you had, extensive PRP and prolotherapy. Your ligaments are in a pretty good place now. And then when we started working on the tendons, what did you notice? What did you feel? And how has it changed things for you?
Yeah, immediately it was immediate stability. So once again, perfect example of this is the first appointment that I had with you in my most recent visit to Florida. Um, what ended up happening was I walked in and I was showing you, okay, this is what exercise I'm doing, this is how I'm doing it, et cetera, et cetera. And you had said you were criticizing the positions that I was ending up in throughout the course of the contraction. And no matter how hard I tried to get myself in that correct position, it would only last for a very transient amount of time. It was like half a second or something. Because as soon as I went to do the exercise again, I went right back in the position. And no matter how much muscle tissue I recruited, no matter how much brain power I tried to meticulously focus on certain areas, it didn't work. It was just being pulled back into the position. After that, then I received treatment that day. After that, I stood up and my forward neck posture wasn't as forward anymore. My shoulder issues, they weren't as forward anymore. They it was an odd feeling. So with the dry needling, what it does is it will cause your tendons to be sore. So I felt sore, but I also felt a lot looser, if that makes sense. So you'd think that soreness is necessarily associated with tightness, but that's not true because you were targeting the tendon, which actually it allowed my muscles to relax into a normal postural position.
Well, you were talking about your immediate response to tendon dry needling. And I think one of the interesting things that you brought up, Eddie, was that even though you were sore and you felt a little bit of inflammation, you felt looser. And I want to explain that in a little bit greater detail because there's still people that are actually aware of tendon dry needling, which is very few. There's a
Right.
little bit of a misconception about even within the people that are aware of it over really what takes place and what happens. And when you contact the tendons in a correct way, in a way that helps them to bring a regenerative process and increase the density of normal collagen fibers and remove abnormal sympathetic dominant nerves that ingrow into degenerated tendon and remove little tiny capillaries that are trying to build into there that are a failed attempt at healing, you actually gain more stability. You gain more stability. I want to really push that home that when you contact tendons correctly, not just the muscle belly, you gain more stability. So many people think that stability comes only from ligaments, and that's absolutely wrong. Your mid position, like if I'm moving and I'm not at the end range, it's really exclusively or predominantly controlled through your tendons. The ligaments do give a reflex, there's a ligamentomuscular reflex, and they help with proprioception and what muscles should be active and where they should be firing. But they don't become as active when they're not being stretched. So if you're in a mid-range position where the ligaments are not under much tensile force, they're not sending too much signaling to the body over joint position sense and what muscles to activate and how to hold your form until they're strained. Then they start to become more predominant. So I think that the interesting part is that when we contact tendons correctly, you do get an immediate change, which Eddie just commented on. He felt easier to hold his head over his shoulders. His upper back was more relaxed. He's had many other improvements that maybe he'll comment on as well, just from the few visits we've had together. However, when you have healthy tendons, your body can function at a higher level because the tendons control that mid-range activity and ligaments only prevent excessive motion at end range. So a lot of times when people have instability and they only get ligamentous care, I've seen miracles happen. I mean, I really have. And that's one of the most amazing things that led me on this journey towards finding tendon dry needling is such a unique value add that was underutilized or maybe not understood at all, even by all of the leaders in the regenerative medicine field. I think that they only look at tendinopathy when it shows up on a shoulder MRI. Oh, there's a tear in, the rotator cuff, and then they treat it, but they don't look at it systematically as how is the person able to hold their posture and what's limiting them? Why do they perpetually get a tightened trapezius and their suboccipital muscles are weak, even though they've gained full ligamentous stability? And why do all the other things that they're doing not seem to help, like using a Denerol or just looking up? And what's the missing link? And it's often that the tendons are degenerated, causing a chronic shortening, tightening, dehydration of the muscles, activation of the wrong muscle in the wrong order because the tendon is screaming, Eddie. It's screaming, do not use me, muscle, or you may rupture me off the bone, which could be a life-threatening event because you could irritate the vertebral artery then, or the carotid artery, or compress some other structure. I won't be able to hold your head up anymore. So the tendon is kind of like the general in the military, and it can control what the muscle gets to do. And over time, it leads to this progressive dehydrating, shortening, inactivation, and then you get nerve signaling and pain and brain fog, and you can't think as clear. And when it comes to things, just to jump to another topic that you mentioned about, well, diet can cause brain fog and all these things, 100%. But honestly, usually you should know within a couple of months of initiating some kind of intervention if it's starting to work. So I would implore anybody watching this that yes, start with the things you can do at home. Clean up your diet, get connected to nature. Think about simplifying what thoughts enter your mind. Be grateful, drink water, practice movement exercises. But if you're not getting progress within a pretty concise period of time, you have to look at what's the missing link. Because, Eddie, would you agree that it's usually not, wow, I've been doing this for 6 months. I just need 6 months and 2 weeks. Usually you can get some idea that something's working within the first few months.
Yeah, I would agree with that. I mean, it always depends because everyone, biodiversity, every single person, some people are extremely chronically metabolically ill, and it can take 2 years for full remission, I've seen, with certain interventions. But those are sort of on the extreme ends of the bell curve, I think. I
Yeah.
think that for as a general rule, you are correct, for the 67% of people, in the center. But yeah, no, I completely agree, which is why, you know, healing isn't just it's not a dietary thing. It's not a one piece thing, one solution thing. I think that there are a lot of different incongruencies that we have in our lives that are, in relation to how we used to live. And I think that they all, once again, they all play a role. And so, yeah, you can change one thing, but it's not necessarily going to be. Yeah, I wouldn't even necessarily depend on the one dietary change that I encourage people to take on fixing you completely per se. I would say it's a composite sort of behavioral change. It's not just diet. It's everything that you just said. You listed multiple things. You
Yes.
enumerated multiple things, and I think that it's a composite solution, not a one solution issue. We live in a very modern world. We've had many different interventions. I mean, it would be kind of mind blowing if it took only one thing to fix all these issues. Yeah, I think it's multiple things. But so we've been using the word treatment a lot, but we haven't really been using the word resolution. However, it would be kind of appropriate to use the word resolution considering that this isn't simply a treatment. This is actually a resolution to a lot of these problems. So can you explain how this is actually a resolution to the problem, this tendon dry needling, instead of simply a palliative treatment?
So it comes down to what I said earlier about that tendon dry needling, when performed correctly, creates stability. So the whole mechanism of action of tendon dry needling is to create a small amount of trauma into an area that has not been able to have cell turnover. So in a chronic degenerated tendon, which can happen just environmentally, genetically, from poor posture, excessive force, the slow creep hysteresis and set that I described earlier of being in the wrong posture and not having enough break, and really injuries and diet and chemicals. There's so many reasons that this can happen. Is that we disrupt that degenerative cascade by creating a very small amount of micro trauma by using fenestration or actually contacting into that tendon with a needle, which allows new blood that your body is just freshly created for you, right? Your body is constantly turning over blood and cleansing it and then bringing it back into circulation. It allows that blood that has tons of things in it that can heal. You know, it has platelets, it has exosomes, it has stem cells, you
Hmm.
know, and all these different things inside of it that are healing. To rush into that degenerated tendon, and then they pull out the waste, and it starts the healing process. So connective tissue is inherently designed, you know, God-given, just, you know, one of those things that it is how it is. It's designed to not allow a lot of blood in or out because it has to be very fibrous and strong. And when areas have an extreme turnover of blood, they're more vulnerable to tears. Like people more often will tear a muscle or get a big bruise in a muscle, but it's a little harder to have that happen to a tendon or ligament. The force has to be pretty excessive. And so the tendons and ligaments are inherently an area that we need from time to time physical intervention on because they don't have the best way of self-healing. So when we interrupt that degenerative cascade by contacting the tendon directly with a needle, blood rushes in the area that has platelets, exosomes, stem cells that really, in most people, is all of the regenerative capacity that you need is already built into your own body, into your own blood. It doesn't need to be
Right.
concentrated. You don't need to always pull out bone marrow from, you know, which has a stronger regenerative capacity. But your body with its own blood, as long as you have reasonable health, I've had people that are in their 70s and I do tendon dry needling with them and they get better and they stay better.
Right.
And so you don't really always need, and I know that I'll probably get some people saying that this is not true, but it's good that we have people that are focused so much on how do we create the best kind of, you know, platelet-rich plasma and how do we change these regenerative agents for specific use cases. And I do believe that, you know, the future will unlock some pretty exciting, you know, specific use cases for those kind of treatments. But imagine a world, Eddie, where in every city that there are doctors, physical therapists, chiropractors, nurse practitioners that fully understand the power of just contacting connective tissue correctly, the cost reduction versus a five,
Oh, yeah.
$10,000
Yeah.
regenerative medicine procedure that just targets one area. And if we could bring this at scale, all of the healing that's possible, and really with the reduced costs and value to so many people suffering with these conditions.
Yeah, I think about that all the time, actually. Especially, I mean, it helps that I've actually been afflicted by this in an extreme degree. But I mean, that's the silver lining is that now I know like the importance of it for everyone else. You know, just because someone might be 10% as bad as I am doesn't mean that they, aren't still experiencing problems that could be helped with this solution that now I can help bring to light and bring to awareness as I'm doing right now. This is the first time I'm doing it. If I decide to, if I have more questions for you that I think are important, I want to interview you again. I'm sure that you'd be down for that. I'd definitely like to do that. But anyway, so how many times can people actually expect to have this treatment done before they experience complete resolution? I know that's plus or minus depending on the person, but what have you seen in your practice?
That's a great question. I think on average it takes anywhere between 5 to 20 visits. And you have to think about it like this. There are 4,000 tendons in the human body, approximately 4,000 tendons, and only 900, give or take, ligaments.
Ligaments, yeah.
So just considering the head, neck, and shoulders, which can influence each other very intimately, there are hundreds of different spots that you may have to contact. And so, with that in mind, for each visit that you have with an individual, you may only be able to contact 30 or 40 spots in one visit. And some people initially, we can only target like 5 spots because they're so sensitive, the pain of the treatment, the discomfort, how quick their body reacts because they're stuck in a chronic sympathetic overdrive where everything causes a reaction. And so, you very often have to have between 5 to 20 visits to make a significant and life-altering change where all of a sudden you can hold your head up with ease. All of a sudden you don't get that sharp pain that shoots up your head. All of a sudden you can return to activity without feeling like you're going to break down.
Right. Yeah, no, that's good. In fact, in the grand scheme of things, given how relatively cheap that treatment is, the cost to benefit ratio, how low it actually
Yeah,
is in the grand scheme of things, that's not that many treatments actually, not at all. And you'd be saving a lot more money that way, and it's a lot more effective, and it's a lot less invasive as well.
yeah,
Might sound ironic considering you're still getting needles in you, but it's a lot less invasive than having a fusion, for example. So, and it's not permanent, you know?
or an
Like,
injection. I mean, the unique thing about a needle is that it was Janet Travell that I got the inspiration from, that you only needed to use the needle. So she was the founder of the conventional dry needling, which I've taken the course, myopain seminars, and completed that course maybe like 8 years ago or so. And I first studied acupuncture when I was still in chiropractic school, probably about 13 or 14 years ago. But there was something that she said, that she was treating John Kennedy, right? She was treating the president at the time, and she was a brilliant medical doctor. And he had a lot of fascia, chronic pain. And she realized she was doing too many injections, and this could be negative for his health. So she just tried using the needle by itself, and she still got results. So that was kind of like in Western medicine, the aha moment, which
right.
people in Eastern medicine have known for thousands of years. The power of contacting certain areas on the body with just a needle and the healing that it can bring. But really, the correct stimulation, it's through mechanotransduction. If the viewers, or if you'll look up a little bit about mechanotransduction, so it matters the way that you insert the needle, how you contact the tendon. There's so many different things. I mean, for example, with mechanotransduction, Eddie, they found that a 3% stretch on skin could be anti-inflammatory, and I think it was like a 5 or an 8% stretch could be inflammatory. So, and then it causes gene regulation, protein synthesis. So many different things happen from mechanical stimuli that are incredible to our entire organism, to creating collagen, the right kind, to knowing what to do. So, I think that the technique of performing tendon and superficial ligament dry needling too, it's very easy to regenerate some of the superficial ligaments, or stimulate them to regenerate by contacting them with a needle as well. But the whole technique is important, and it's what makes the difference. Versus, imagine if you're doing an injection of PRP or bone marrow, so what exactly does the doctor do? Do they contact the beginning of the ligament and then push the fluid in so it actually goes inside of the ligament, or are they also still usually releasing the fluid while they're retracting? I think that's kind of like a safe technique. And then, so does it get around the ligament? And then, so the interesting part is that it only creates typically one hole in that connective tissue, and then the regenerative agent goes to work. But with repeated fenestration or tendon dry needling, a skilled practitioner is able to create up to sometimes 20 or 30 microscopic holes, whether they're zero point 0.2 millimeters in diameter of a needle or zero point 0.4 millimeters in diameter of a needle. Very small, much smaller injuries than typically with a needle that could give an injection. So you really are almost essentially, if you do this correctly, acting kind of like one of the great sculptors of marble, that you're just making these little tiny fine-tuned chiselings to help the body regenerate in the spaces that it needs it most. So I think that the potential is still to be unlocked here, and we have the opportunity to really, really change the way that people address structural health through the addition of spinal curvature work, but also through exclusively teaching people about tendon and superficial ligament dry needling.
Awesome. Yeah. What are some of the most important things people can do before and after receiving treatment to hedge against the possibility of either developing these issues again or worsening the issues if they haven't received treatments yet?
I would say before getting treatment, try everything you can do from home, clean up your diet, make sure that your mindset's right. If you feel that you need help there, consider a brain retraining program. Make sure that your environment is clean and healthy, and you're really living from a grateful perspective. Even if you are suffering, there's still ways to find gratitude in day to day. Often that'll really reverse some of the symptoms you're acquiring. And then if you feel that you really have a structural problem, I would say you have to find somebody that is skilled in this kind of a method. So I'm releasing a training course pretty soon for other practitioners, and You'll also be able to get an initial understanding of your posture and things that you can do from the software that's coming out soon from Posture Vision. Um, to prevent yourself from having a recurrence of this, it's all about maintenance. If you go to the dentist and they say your teeth look great, it doesn't mean that you don't have to go home and floss that night after eating. So I would say spinal hygiene is really important, and building a routine that allows your body to stay structurally healthy is really important. So, if you don't have that routine, please look for Posture Vision coming out soon. That's kind of one of the goals of it, is to not only help people get healthy, but to maintain that health structurally.
Cool. Yeah, great. You have a YouTube channel as well. What type of content do you post on there, and what is the channel name for people that are curious and learning more about this stuff from you?
I primarily post a lot of testimonials because it's great that we're having this talk, Eddie, and that you firsthand have experienced the positive changes of tendon dry needling. But I really don't like it to be primarily myself that's just blasting this out to the world because, first of all, doctors are really hard to convince of anything new or different. And then I would much rather have it come from people that have experienced the positive changes. So there's a lot of testimonials of people that have gotten a big push in the right direction of their health after getting care, whether it be spinal curve correction, gentle adjustments, and or one of the big treatments that I do is the tendon dry needling because it's the one thing that people can't find at other places very well. So there's tons of chiropractors that deliver great adjustments. There's now a lot of regenerative medicine facilities that do great prolotherapy or PRP, but there's a lot of offices that'll help you improve your posture and your spinal curve. But very few people really understand how to deliver tendon dry needling in a meaningful way that can really get people going in the right direction. So I share a lot of content about my office, my practice. You can find me on YouTube at Dr. Hutcheson, Doctor Hutcheson, and we'll throw that link up on the end of this video as well.
Yes, it will also be in the description below for anyone that actually wants to migrate down there. Just as a final question, I know you sort of touched on this already, but I'm going to ask this anyway. Emphasis is, repetition is still it still has utility. So for people who may be in a desperate position still, where they may have completely optimized their diet, once again, like we talked about, completely changed their entire lives around to something that at least best approximates an ancestrally consistent, lifestyle, what we're most adapted to within the realm of plausibility for their lives, but are still having issues like joint pain, localized nerve inflammation, and neurological disruptions, etc. And therefore would like to schedule an appointment. Let's say that they can't really find, people that do dry needling, at least with the amount of efficacy that you employ it. What if they would like to schedule an appointment with you? How can people go about doing that? Would that be on your website as well?
Yes, there's a chatbot on the website. There's a scheduling tool on the website on drhutchison.com, and we're happy to receive you and schedule an appointment time or try to guide you to somebody that may be able to best help you more near to your home, wherever you live. And Eddie, that's a really good point, is that it is a combination. The diet and the nutrition and ancestral living is the beginning of it, but you have to put together all the other pieces of the puzzle. And one of the big ones that we've talked about today, I hope that this will add value to your viewers, and I really appreciate you for having me on and for giving this time for us to share this story.
Yeah, no, I think that once again, it's incredibly important. I'm glad to have finally been able to have you on the channel. Like I said, this was much anticipated by me. It was always in the works, and I'm glad to have had that manifest today. So, well, once again, thank you for coming up on the channel talking about this. I hope that this benefits many of you viewers that may still be having some issues, that seem to be very, arcane. You don't really know what's going on with that and what the causes are. Maybe this can give you an idea and point you rather in the right direction. So thanks, Dr. Hutcheson. I will see you probably soon enough later on in a few months again for more treatment. And yeah.
You're welcome, Eddie. Thank you so much for having me, and I look forward to seeing you soon.